Okay, Bismillahirrahmanirrahim. Let's begin our session today with Al-Kitab Al-Fatiha. Bismillahirrahmanirrahim. Alhamdulillahirrahmanirrahim. Ar-Rahmanirrahim. مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Amin, 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 ya Rabbal Alamin. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera and good morning, everyone. Ladies and gentlemen, welcome back to Malaysian Anatomical Association webinar series for 2021. My name is Zaitun Natafin binti Zamri. I'm from International Islamic University, Malaysia. I will be your moderator for today's event, inshallah. Okay. So today's event is actually the second webinar organized by MAA in conjunction with the 5th biennial general meeting that will be held afterward, inshallah. So if you still remember, during the first webinar, we have discussed about how to transform the anatomy education during the COVID pandemic. During that time, we have 4 distinguished panelists who shared their experience and in terms of teaching and learning during the first MCO. But don't worry if you miss the first webinar, because we already recorded the session and uploaded in our official Facebook feed. So feel free to watch or rewatch, because we had a very fruitful discussion during that time. So today, I'm very glad that we have a special guest online from Kota Baru, Kelantan, who I regard as the Sifu or the expert in anatomy education. She will be sharing with us on a topic entitled Imagineering Anatomy Assessment Amidst COVID-19, Turning Obstacles into Accomplishment. So before I invite her to deliver the presentation, let me read her biography. Our speaker is Associate Professor Dr. Siti Nurma Hanim Hadie, obtained her medical degree from UKM in year 2005. Yeah, for year 2005. Afterwards, she pursuing her master degree in clinical anatomy and PhD in medical anatomy, medical education at USM in year 2010 and 2017 respectively. Since then, Dr. Siti has successfully secured a number of grants and published many articles and workbooks, especially in the area of anatomy education, cognitive load theory-based teaching, teaching methodology, histology, and histomorphometry. She also received a number of awards. Among these include silver medal in the 3rd International Innovative Practices in Higher Education and gold medal Rugayah Jaafar Health Profession Education Award in year 2016. Currently, Dr. Siti is the head of anatomy department from School of Medical Sciences, USM, and also the deputy president of MAA. So, ladies and gentlemen, without further ado, I would like to invite our speaker, Associate Professor Dr. Siti Nurma Hanim Hadie, to deliver his presentation. Please welcome.
Okay.
How are you, Dr. Siti?
Alhamdulillah, thank you. Good morning.
Good morning. Okay. Okay. Right. So the floor is yours.
Okay, thank you so much. Bismillahirrahmanirrahim. Thank you, Dr. Zaitun, for your kind introduction. Assalamualaikum and a very good morning, everyone. First of all, I would like to thank Malaysian Anatomical Association for giving me this opportunity to conduct this short webinar on anatomy assessment during COVID-19. And I think that this topic is very relevant to us because at the moment we are facing with a lot of challenges and uncertainties when we practicing, or when we are conducting our online assessment. So I hope at least this webinar can help us, can trigger our mind on how we can actually turn these challenges into accomplishment. So as you can see here, my topic is Imagineering Anatomy Assessment Amidst COVID-19, Turning Obstacles into Accomplishment. So some of you might be asking, okay, what is Imagineering? Because this word sounds a bit bombastic, but rest assured it is not really a bombastic word, okay? It's just a term that was coined from two words, which is imagine and engineering, okay? And it refers to implementation of creative ideas in practical form. So meaning that if you have an idea, okay, that idea must be a creative one, and more importantly, it can be implemented in the current situation. So meaning that it's doable, it's practical, it's feasible, it's suitable in the current context. So as you can see here, the word is not really a new word. It was there for almost 31 years. It's 31 years ago, 1990. It was introduced by Disney Enterprise. Okay, because why? Because Disney need to be practically creative in order for them to remain relevant in the industry, you know, in the creative and also animation industry. So that's explain why Imagineering is not really a popular term. Okay, and not until recently. Okay, after the COVID-19 pandemic struck, you know, educationists, educators, and also entrepreneurs, they begin to use this word, okay, to find solution to their problems. Okay, this is what we are going to do today. We're going to Imagineering our anatomy assessment. All right, so for today's session, we're going to focus on 4 different areas. The first one is we're going to revisit the ultimate goals of assessment in medical education, and I'm going to relate it with anatomy. Okay, and then secondly, we're going to reflect on the assessment practice in new norms. Okay, the third one, going to explore the various methods of anatomy assessment during COVID-19. And last but not least, we're going to envision the future practice. Okay, we have to accept the fact that change is inevitable, and we have to embrace these challenges for future practice in anatomy assessment. But before that, okay, let us have a look on the challenges of online assessment that I have gathered from various literatures. And as you can see here, some of these literatures are were published before COVID-19. Okay, so some of these challenges might not be relevant to you. Okay, but let's have a look at the overall picture. Okay, the first one is about the learning outcomes, about the attainment of learning outcome. Okay, as educators, we know that not all learning outcomes can be assessed via online assessment. Like in our context, we don't know whether the online OSPE, online spotter exam can really capture or can really measure our psychomotor competencies, okay, the practical skills. And in fact, we have to measure the different levels of psychomotor competency. So that is our problem, okay, quite a big problem to us. Secondly, is about the rules and regulations, okay. Although exams were done will transform into a digitized form, okay, done online. However, we still use some rules and regulations that were used during the face-to-face assessment. Okay. And another issue is about the integrity and security of online assessment. For example, like if we talk about online cheating, okay, many institutions are still using human proctoring, okay, to prevent online teaching, to monitor or to prevent online cheating. Unfortunately, literatures have shown that online cheating is not really effective in preventing the human proctoring. Okay, human proctoring is not really effective in preventing online cheating. Okay, so and apart from that, human proctoring also can impose anxiety to the students, and this in turn affect their performance in the exam. And apart from that, okay, there's another issue with regards to the internet network security. Okay, without a secured network, it's actually difficult to prevent any interference from unauthorized users in the same network, and this in turn will affect the integrity of the online assessment. So when we talk about the integrity and security, this is also very related to the ICT facilities, okay, in order for online assessment to be conducted smoothly, okay, we need a good ICT facilities, okay, good support of ICT facility support. For example, like to address the online cheating just now, it's good to have an online assessment software with lockdown browser features and AI proctoring. Okay, however, that requires good internet network stability. Okay, internet connection stability. So if you want to upgrade our ICT facility, of course, it will impose financial problems, okay, especially for those for institutions that do not have this good financial support. Okay, and another issue is about the preparedness. Okay, not all lecturers, okay, not all students and staff are actually vigilant enough or resilient enough to prepare themselves, to equip themselves with skills on using the tools, okay, using a technology enhanced tools for online assessment. So this can actually impose anxiety and stress as well. And last but not least is about the limited alternatives to online assessment, especially when we talk about the psychomotor assessment. Like what I have mentioned just now, we don't know what is the best measure to assess for the psychomotor assessment. All right, so let us have a look at the ultimate goals of assessment in medical education. Basically, Epstein in 2007 has outlined 3 goals of assessment. Okay, the first one is to optimize the capabilities of all learners by providing motivation and direction for future learning. And to relate this with anatomy, it is about the attainment of anatomy competencies. Okay, there are 3 main anatomy competencies, okay, which are, the first one is comprehension of anatomy theory knowledge. The second one is about the clinical application of anatomy knowledge. And the third one is 3D visualization of anatomical structure. I will talk about this in a bit detail afterward. Okay, so the second goals is to protect the public, okay, by identifying incompetent graduates. Okay, to relate this with anatomy is actually related to the anatomy related competency for safe clinical practice. Okay, basically anatomy assessment can be used to assess the procedural skills, physical examination, and also up to the extent of professional behavior. Okay, and the third goal of assessment in medical education is to provide a basis of advanced training. So this is very much related to those who are pursuing the postgraduate study, for example, like they want to become a surgeon, okay, anatomy teachers and also researchers. Okay, so anatomy assessment can be used to assess the surgical knowledge and skills, the teaching skills, okay, and also research and analytic skills. So as you can see here, there are actually 3 levels of goals again, and we have to select, okay, which goal is, before we actually design our assessment, we have to select which goal that we want to achieve. Okay, for example, like this one, this is more relevant to the undergraduate preclinical year students, okay, and also to undergraduate students, okay, not only medical students, but also other health and allied health professionals, okay, and this is more for the clinical year medical students, and this is for the postgraduate student. And apart from that, to design a good assessment, we also must understand how does assessment affect learning. Okay, and basically, okay. So basically, there are actually 3 assessment purpose. Okay, the first one is the assessment of learning. So assessment of learning refers to assessment that evaluate the student achievement. And what are the instruments that can be used for assessment of learning? They are actually exam, okay, written exam, oral exam, and also clinical exam, and not to forget the continuous assessment as well. Okay, and second assessment purpose is the assessment for learning. Okay, assessment for learning is actually assessment that monitors students' learning progress and also learning need. And the instruments are actually mainly done during the class. Okay, the instruments include like group work, discussion, presentation, quizzes, and these are all intra-class activities. Okay. But the assessment were done by the lecturers, by the instructors, okay, and the instructor need to give feedback, immediate constructive feedback feedback after the activity. And the third one is assessment as learning. And assessment as learning assess student cognition, or it actually empowers students to assess their own learning. Okay, meaning there is they need to self-monitor and they will reflect on their own learning. And the instrument include portfolio-based assessment, work-based assessment. And in anatomy, there's one model that actually fits into assessment as learning, which is the silent mentor program. Okay, so for assessment of learning, this is actually our summative assessment, okay, whereby we actually take the marks, okay, generated from these instruments, okay, to make decision that can determine the student's fate. Okay, so this is the summative assessment, and the other two falls under formative assessment. Okay, the difference between these two is this one, assessor is the teacher, okay, the instructor, and for this one, student is their own assessor. All right, but how do we utilize this assessment? Okay, how do we utilize this assessment? Okay, this is actually the assessment pyramid. Okay, traditional assessment pyramid. Okay, as anatomists, we have to admit that we are still exam oriented. At the moment, we are still exam oriented, and we are conducting lots of exams. Okay, to test our students' anatomy knowledge and skills. Okay, so we are actually following the traditional assessment pyramid that was introduced by Earl in 2003. And in this traditional model, less weightage is given to the formative assessment. However, Earl has foreseen a future scenario, okay, that can hinder the function of this assessment pyramid, okay, traditional assessment pyramid, for example, like what we are facing right now, which is the new norms, okay, sorry, which is the pandemic. But we have to be, we have to adapt ourselves with the new norms. Okay, so in this situation, okay, the traditional model is no longer effective. Therefore, Earl has actually developed a new assessment pyramid model. Okay, this is the refined model that gives more weightage on the formative assessment. Okay, assessment as learning and assessment for learning. And assessment of learning, which is the summative assessment, is reserved only for making high-stake decision. Okay, and for us in anatomy, especially for undergraduate students, okay, I myself find it very difficult to create assessment as learning, because usually undergraduate preclinical year students, okay, they are, although they are biologically, we can consider them as adult, but they are actually novice learners in anatomy and in medicine. So they have, not to say poor, okay, but they have a limited ability to monitor their own learning. Okay, but if we have a potential tool to do assessment as learning, it will be good, right? But at least we can try to do assessment for learning, right? But if we want to improvise our assessment, we have to adapt with the current situation, which is the new norms. And these are the 4 new norms in during this COVID-19, especially in higher education. And the first is social distancing. Second is the personal space. And then the third one is small group. And last and not least is the digital platform. So we are actually doing this the most. Okay, we are conducting our exam online through digital platform. But for example, if you can provide a good social distancing for the student, okay, provide a good personal space, and if the exam can be conducted in small group, it is actually feasible to conduct, doable to conduct the exam through face-to-face. However, it should be planned properly. Okay, because you must not violate the utility of assessment, meaning that your assessment must remain valid, reliable, practical, and feasible. Okay, and it also must be cost effective, not necessarily be cheap. Okay, but it need to be cost effective. Okay, it can be expensive, but has more educational impact. Okay, it gives more educational impact. And another thing that we need to consider when we design our assessment is about the constructive alignment. Okay, we must understand, especially in Malaysia, okay, we have to follow, okay, the MQA requirement, whereby we need to conduct this outcome-based education. Okay, so which means that we have to actually comply with the MQF 2.0 framework at the moment. So basically under constructive alignment, okay, we have to put the students, okay, at focus. Okay, so students are our focus. And then there are 3 elements that we need to consider, which are the learning outcomes, teaching and learning activities, and also the assessment. Okay, and we have to achieve constructive alignment between these 3. For example, like in learning outcomes, we need to spell out what the students will be able to do or know at the end of our anatomy course. And this learning outcome, based on what is outlined by the MQF framework, we need to be very comprehensive, meaning that we can cater for cognitive, affective, and also the psychomotor domain. And in terms of the teaching and learning activities, there are many ways to do it, but these are mainly done before the COVID-19 pandemic, because we can still conduct the face-to-face activities. However, when during this pandemic, online learning dominates. Okay, online learning, most of the teaching and learning were done through online platform. So when we conduct assessment, okay, before the pandemic is face-to-face, but considering the digital platform just now, and considering that students are learning through online, we also need to incorporate online as well, especially when the students are not in campus. Okay, and so basically alignment is achieved here. However, what about this one? Okay, what about this one? Okay, because we have sets of competencies that need to be achieved. And remember, as I mentioned earlier, it's very difficult to achieve not only psychomotor, but also affective domain when assessment is done through examination only, meaning that we have to incorporate not a formative assessment to our assessment practice as well. We cannot rely only on the summative assessment. Okay. But how to balance? How to balance this assessment practice between new norms, utility of assessment, and also constructive alignment. Okay, basically, of course, the our focus should be the competencies. Okay, so basically, we need to achieve the cognitive, affective, and psychomotor learning competency. We must assure achievement of these competencies. How? Through formative and also summative assessment. Okay, secondly, remember that the students are learning through online, so we must utilize the digital platform as well. Okay, and the third one, if the learning outcome, certain learning outcome cannot be achieved through online, we can consider doing it face-to-face, but we have to ensure that these norms is fulfilled. For example, like we have to have good social distancing, good personal space, and if the exam can be done in small group, that would be. And then, however, whatever improvisation that we are doing, okay, make sure that the utility of assessment is achieved, meaning that the exam is still valid, reliable, practical, feasible, cost-effective, and it also gives educational impact. Okay, so with this in mind, we can start thinking how we can transform the anatomy assessment. Okay, but how to do that? All right, the first thing when we want to transform or change our practice is we need to evaluate our previous practice. Okay, we need to evaluate our previous practice, and one way of doing it by conducting a SWOT analysis. Okay, SWOT analysis, I think we cannot do this alone. You have to do this with your department members or academy or faculty members. Okay, we need to find out what are our strengths, okay, weakness, opportunities, and threats, okay, based on our previous practice. And then we have to think on how to find ways to increase the strength, okay, to convert the threats into opportunities and to reduce the weakness. Okay, so when we understand or we know our strength and weakness, okay, we can start planning for future assessment. Okay, but how to plan, right? So there are 4 major areas that we need to consider. First is the competency. Okay, what we need to do is we need to ask ourselves what the students will be able to know or do when they complete our anatomy course. Okay, And then we can start thinking about the assessment design. Okay, how are we going to design our assessment to ensure that it can to ensure the achievement of these competencies. Okay, and to ensure that our assessment design can be implemented successfully, we also need to think about the assessment methods and tools. Okay, what are the assessment methods and tools that can support this assessment design? And last but not least is we have to look at the overall picture of the educational environment in our own institutions, okay, because some of the factors are enablers and some are disablers to our practice. So we have to perhaps modify our assessment design based on these factors later. All right, so let's have a look one by one, the competency first. Okay, this is a very good paper by Showman and Chandralitak in 2012, published in Anatomical Sciences Education. So this is before a pandemic. Okay, actually the authors did a study and they came up with 3 anatomy competencies for undergraduate students. Okay, the first one is comprehension of anatomy theory knowledge. Okay, second one is about the clinical application of anatomy, and the third one is about the 3D practical application of anatomy. Okay, so this was described in their paper. Okay, so but their concern is more on achieving 3D visualization ability, 3D visual spatial ability through practical hands-on exposure. Okay, but in our current context right now in pandemic, okay, when the hands-on exposure is very limited, okay, we could not actually conduct a dissection. Okay, students have a reduced chances, opportunity to go to the lab. Okay, so we could not have that practical component at the moment. So what is feasible is we can try to find ways on how we can ensure achievement of this 3D visual spatial ability. Okay, so meaning that perhaps like if it's in teaching and learning, we are using software and other innovative methods. As long as student can achieve this 3D visual spatial ability, so that would be okay at the moment for temporary measures. So same goes with the exam. Okay, the practical component, it's okay to achieve until to the 3D visual spatial ability. And for the kinesthetic learning experience, okay, that can be revisited later. Okay, once the teaching and learning, face-to-face teaching and learning session can be resumed in the future. All right, but not only that, okay, once we have identified the competence, we also have to be, as I mentioned earlier, we need to be very holistic. Okay, not only cognitive, we also have to look at the psychomotor and also affective component. And we also have to look at the hierarchies. Okay, hierarchies. For example, like in cognitive, we are using Bloom's taxonomy. Okay, so there are 6 levels, C1 until C6. And for undergraduate level, this is what outlined by the MQF. Okay, so for undergraduate level, C3 is the minimum requirement, meaning that student can apply anatomy knowledge in clinical context. Okay, so I think we don't have much problem with the cognitive competency through online assessment. And in terms of postgraduate, it can go up to create, because they need to create research proposal related to anatomy, for example. Like in psychomotor, okay, psychomotor, we are using the Simpson taxonomy. There's P1 until P7. Okay, and for undergraduate, the minimum requirement is P3. Like P3 means guided response, meaning they can actually imitate certain procedures based on the guidance given. Okay, for example, like they can do body painting, they can conduct dissection when they are given a guidance, proper guidance by a teacher or mentor. Okay. So this is our problem, because during online, okay, assessment, we cannot achieve P3, P3, because they cannot conduct any hands-on activity. So the highest that can achieve during online OSPE or online spotter exam is only perception, which is P1, meaning that when they are given a diagram, okay, they can only identify the structure to the of the labeled structure. So that is at the level of P1 only. So that is our limitation. And then for the postgraduate students, okay, can go up to P5 or P6, because at P5 we expect the postgraduate student be able to perform skillful performance, like they can independently, okay, so they can conduct dissection independently, they can conduct or give lectures independently. So that is the level that they should achieve. Okay, however, I'm not worried about postgraduate, because usually postgraduate students they come in small groups. Okay, it's easy to it's doable to conduct a face-to-face assessment and teaching and learning. So postgraduate is not really an issue, at least in my context in USM. But for undergraduate, yes, it's a big problem to us. Okay. And then for effective competencies, okay, we are using the Kraftwerk taxonomy. Okay, there's A1 until A5. Again, for undergraduate is A3. This is minimum requirement. At least they can associate value of knowledge that they acquired. And for postgraduate, it can go up to A4 to A5. Okay. Again, online exam, it depends actually to your assessment design, but most of the time, if the assessment is not designed properly, it's a bit difficult to achieve effective competencies. Okay, so but the best way to achieve this effective competency is through formative assessment. All right, once you are clear with the competency, okay, you can move to the design. Okay, you have to start designing your assessment. So actually, I'm using an example here that I adopted from the programmatic assessment design by Van der Vleuten in 1996, but this is actually not the original programmatic assessment design, where I will explain later why. Okay, when we want to design our assessment, it needs to begin even before the student actually enroll into our program. Okay, so just imagine that this is the whole semester or academic session, and the students have several classes. Okay, and when the students enroll, okay, we have to actually design our assessment. It needs to be holistic so that the student can be assessed in longitudinal manner. Okay, so basically you can design for assessment for learning for each of the class. And then if possible, okay, you can also add assessment as learning in between. Okay, and then of course you need to have continuous assessment, and at the end is the final examination. And these are all summative assessment, and these are the formative assessment. Okay, and to ensure that the constructive alignment and also utility of assessment is achieved, of course you need to follow the blueprinting. Okay, the blueprinting and also vetting. Sometimes we tend to ignore the quality of our continuous assessment. We tend to just use previous exam questions if it is done through exam instrument, okay, like written exams and so forth. But we tend to ignore that because we tend to use a previous exam question, which is actually not advisable, okay, because the reason why is we want to ensure that the achievement of learning outcome will be holistic enough. Okay? If some of the learning outcome has been covered here, so we can reserve the other learning outcome here. So that is the reason why we need to follow the blueprinting and also do the vetting. And why this is not really a programmatic assessment design? Because in the original programmatic assessment design, there is no boundary between assessment, formative assessment, and also summative assessment. Okay, this assessment here is considered as assessment point, and all these marks, okay, achieved from this assessment will contribute to the final mark. So it's actually a bit taxing for the lecturer. And I think that is not really feasible in our context, especially when we have not enough number of a lecturer. Okay, but it's good if you have good support. If you can go through to this programmatic assessment design, actually is a very good assessment design. Okay, because it's very holistic. Okay. And when we are clear with our assessment design, then we have to think about the methods and tools that can be used in our assessment. For example, like undergraduate students, these are the hierarchy that they need to achieve, at least C3, P3, A3. I think for formative assessment, it's we can achieve all C3, P3, A3. Why? Because we can conduct hands-on exposure through online. Okay, meaning that we have to do activities like body painting. The students can still do body paintings at their on their own. Okay, but need some guidance and need to be creative. Okay, so these are the tools that can be used, okay, so for example, like problem-based learning, okay, team-based learning, OSPE-based practical, student seminar, structured group tasks, okay, individual group tasks. But when we want to impose a task to the student, we have to consider the student workload. And perhaps when we do the curriculum review in the future, we should include this in the discussion as well. Okay, and for postgraduate anatomy, okay, actually nothing much, okay, because everything can be done face-to-face sometimes. Okay, so for example, like this is writing research proposal, conduct cadaveric dissection, conduct demonstration practical, and for those who will become anatomy lecturer, it is good also to actually test their teaching skills through micro teaching and macro teaching skills. And actually, I omit assessment as learning, okay, because I think it's very difficult for us to design, okay, but we have a very good design already, which is the silent mentor program, okay. And for assessment of learning, okay, this is what we are doing right now, okay, as the same thing actually, MCQ, essay, OSPE, problem-based. Problem-based learning is usually done as continuous assessment, okay. And but the one that I want to highlight is that psychomotor is a bit difficult to achieve because it's only P1, okay, P1, right? And for postgraduate anatomy, everything can be done, okay. For example, like okay, this is defense, viva voce, multiple mini viva. Okay, I think this is new to some institution, but we are doing this to assess our master in clinical anatomy knowledge, okay, applied knowledge, MCQ, and so on and so forth, right? So the last thing to look at is at the educational environment. I think there are many more factors, not only sport, but we will have to look at the factors that can affect and also hinders our assessment design. For example, like university governance, their policy, their support, funding, and so on and so forth. And then the lecturers, okay, and staffs and students, what about their mental well-being? Okay, what about their preparation, familiarity, family support, time zone difference, especially when your institution have many international students, and this is quite a big issue also. And then integrity, security, like I have mentioned earlier, and also ICT facilities. Okay, so these are the factors that we need to identify before we execute our assessment. Okay. With that in mind, okay, let us find solution to our challenges or problems. Like for example, like learning outcome, what we can do is we can optimize the formative assessment, okay. For rules and regulation, I think each institution have to modify their policy, and perhaps we can also think about digital blueprint, okay, not as temporary measure, but for future use of digitized exam. And integrity and security, as academician, we need to conduct need analysis, okay, need analysis to find out what are our problems related to integrity and security, and then we need to convey or communicate our needs to the higher authority. And for the preparedness, we have to make ourselves available all the time to go for the professional development, try to seek feedback from the students, okay, and also do research in anatomy education. And for limited alternatives for psychomotor assessment, I think we still don't know, but the best to do it right now is to revisit the psychomotor assessment when face-to-face teaching can be resumed. But for high-stake exam, we can consider face-to-face small group assessment. What is our future practice in anatomy assessment? Okay, I think we are going to IR, Industrial Revolution 5.0, okay, which is high tech and high touch. Okay, so I think in the future our assessment will be hybrid, okay, meaning that we will doing exam in digitized form and face-to-face, and also we'll be synergizing the summative and formative assessment as well. And assessment will become more student-centered because we give more focus to assessment as learning. And of course, in the future, we're going to use artificial intelligence, especially for psychomotor assessment. Okay, we never know. Okay, And then the multimodal assessment and multi-point assessment, okay, this actually will address the sampling issue because we measure at multiple points and we're using multiple approach. And it's holistic, okay, holistic because the exam is not, they will not only assess for specific, but also will assess for generic competencies. And since we know how to design our assessment, okay, the future assessment will have good design and adaptable to change. So this is my final thoughts on these issues. Okay, in the future, okay, we hope that we can actually create a future-proof and future-ready assessment by leveraging the formative assessment, okay, and also by leveraging the technology. And we have to adhere to the best practice, meaning the utility assessment and constructive alignment. And assessment need to be revisited, okay? This is our short measure at the moment, okay? Learning outcome that could not be assessed online should be revisited when condition allows. And also, we need to find local context solution, okay, that fits to our own context. So meaning to ensure the feasibility of assessment. And last but not least, we must embrace the challenges, okay? Online, we have to think positive that online assessment actually provides opportunity for change, okay? Because our assessment become more holistic, okay? We become more creative, we become more innovative, and we begin to use technology. But don't blame ourselves too much if we cannot fulfill the expectation because adaptation requires time. I think that's all from me. Thank you for your attention, and I welcome for any questions. Thank you.
Thank you very much, Dr. Siti. Very informative talk for sharing. Despite of the restrictions, still, based on your presentation, we still have ways how to maneuver within this limited condition in teaching and learning. So I think let's open for Q&A. I think we have one question in the chat box from Dr. Niraj. Okay, regarding cognitive domain in assessment, if you follow 100% application, many essential outcomes, it remain unassessed as it's not possible to prepare application-based question in all analytical structures. The accreditation agency should understand and make some percentage as report and comprehension. So what do you, perhaps you have any comment on that, Dr. Siti?
Okay, regarding, I'm reading the question again because I couldn't.
It's more perception, more on opinion. Yeah.
Oh, okay, sorry.
Okay.
Assessment, you follow 100% application when essential outcomes remain unassessed. Yeah, correct, Prof. Correct. Yeah, your concern is actually very correct. That is one of the threats of assessment in during this pandemic. You know, threats of validity of assessment during this pandemic. Because if you want to talk about threats of validity of assessment or online assessment, one of the important feature is the content. Okay, the content is why, because we cannot sample. Okay, we cannot sample all the learning outcome. Okay, that were the content of the learning outcome that were outlined at the beginning. So that is actually one threat. But yeah, but as I mentioned earlier, we can actually address them in our design. For example, like we can use some of the learning outcomes in the formative assessment. Okay, the one that must know learning outcome, perhaps we can reserve that for final exam. Okay, so that is one solution, I think.
Okay, thank you, Dr. Siti. Next, from Dr. Siti, what may the role of artificial intelligence?
Okay, thank you, Prof. What may be the role of artificial intelligence? That I mentioned that in Malaysia, okay, we have very limited limited exposure to artificial intelligence, particularly because we have lack of funding. So at the moment, I think for the Westerners, right? Where Westerners they have this privilege of conducting assessment using artificial intelligence. Because artificial intelligence, like I've mentioned in my final slide, we can actually conduct in the future assessment, we can actually conduct our psychomotor assessment using artificial intelligence. The one that I can think at the moment is like the laparoscopic surgery. Laparoscopic surgery, that is also one of the artificial intelligence. We're doing laparoscopic surgery remotely. Okay, the students is, for example, in Malaysia, but the lecturer is in UK or US something, so something like that. But at the moment, I myself could not actually answer this question because I have very limited exposure on artificial intelligence. But that is what the international community are doing right now. They are moving towards artificial intelligence in assessment. Okay, particularly perhaps we can in the future we can use that to assess our psychomotor achievement, competencies. So that is something that we need to think together in the future.
Okay,
so I hope I answered your question.
Yeah, you do. Next, from Dr. Nohida Unimas. Thank you, Dr. Siti, for the wonderful sharing. What is your opinion on the digital session of practical in anatomy? What is the most effective way of conducting it?
Thank you, Dr. Nohida. Dr. Hida is my friend from IMAS.
Okay.
Okay. To be honest, to say what is the most effective way, it depends actually. Number one is because we still don't know. Number one is because we have lack of data. And secondly, in terms of implementation of anatomy practical digital session, okay, it's actually varied among institutions to institutions. Sometimes one institution may only use demonstration session. Okay, the lecturer demonstrate during the Zoom session, and the student is just a passive listener. So when you are doing that, I think that actually defeat the purpose of practical session because student is not doing anything. Okay, student is not doing anything. But let's say if you are designing your teaching and learning session, okay, with some sorts of activities, okay, for example, like you give the student the chance to conduct discussion among themselves, or to do drawings, to do annotations, okay, and you also give quizzes in between. I think at least they have some sort of like psychomotor. They can do some body painting also. Okay, I think that although it will not 100% cover the hands-on component, at least they have something. They have the activity going on during the practical. So I cannot comment which is the effective or effective. So basically, we need data to say that it's effective. Okay.
Okay, Dr. Siti, the question is coming in more. Okay. From Dr. Yasrul Izzat, thank you for the excellent presentation. What is your opinion on the strategy to assess 3D visual spatial ability in the current pandemic situation?
Thank you, Dr. Yasro. Very interesting question. Okay, visual spatial ability means that the students can actually visualize in their mind, at least like visualize mental. They have this mental clear picture, clear mental imagery of the anatomical structure and with the relations, okay, with the related structures. So previously, okay, before the technology, digital era, usually we learn that through dissection because we can see immediately, right, in front of our eyes, the 3D visualization, that okay, and we can feel it. We can feel the kinesthetic learning experience. But at the moment, in this pandemic situation, that is not really feasible anymore. Okay, so what we can do, I think the best, although it sounds a bit expensive, the best is still using the 3D anatomy software, because at least we can visualize the structure in 3D form. Okay, at least we can achieve that objective. But yeah, it's lacking in terms of the tactile learning experience. So that is why I said we need to revisit it later. Okay, when the teaching and learning resume face to face.
Okay, next one, Dr. Siti. You're very famous today. Yeah? Okay, I think it's a lot of interesting questions. Okay, dear Prof. Siti, with online or digitalized teaching, do you think that students' learning time should be increased or remain the same?
Okay, thank you, Prof. Zul. As I mentioned earlier, when we want to impose something with digitalized teaching, or we want to impose activity into our teaching, okay, we have to consider student workload. Okay, student workload. Remember, do not ignore this factor. Okay, we cannot ignore this factor because student workload can impose to stress and also burnout. Okay, they will not perform and they will not learn. So this is good, actually, a good question, because when we want to do digitalized teaching, okay, digitalized teaching means students need to be familiarized with the software, with the whatever tools that you are using. Okay, so that is actually one road. Okay, and another thing is when we do digitalized teaching, we have to design the activities, okay, activities, and also formative assessment. Okay, but how to a good activity and also formative assessment should comply with the student SLT. But actually it's very difficult, because why? Because our SLT is, we design our curriculum or SLT before the pandemic. So that is one of the challenges. Okay, so perhaps those who are going to for curriculum review in the future, we have to think about hybrid curriculum, meaning that digitized and also face-to-face. We have to think about the student workload. So we should include. So my answer to this is, of course, increased.
Okay, thank you. Next from Dr. Hasman Norman. Salam, Dr. Siti. What is your opinion regarding the implementation of virtual dissection, for example, anatomy, putting aside the challenge of funding and monetary limitation?
Thank you, Dr. Hasman. This is my opinion only. This is my own opinion. Okay, using the 3D, any software, anatomy software, as long as it can achieve, it can help in the achievement of 3D visual spatial ability, so that's good. But you have to bear in mind that there are many software in the market right now. Okay, some actually defeat the purpose. Okay, for example, I just took one example. Okay, there's one learning theory, we call it cognitive load theory. Okay, actually before my institution buy our own software for anatomy learning, my institution just recently bought complete anatomy. Okay, I have gone through to several software. Some are very cognitively challenging, okay, because I'm doing cognitive load, so I know how to actually look at the which one will impose more cognitive load to the students. Some look very interesting, okay, nice pictures, nice diagram, nice 3D images, but it is very cognitively challenging. Okay, so when we want to choose, we must choose how to say, the one that can again stimulate student 3D visual spatial ability without imposing any cognitive load to the students, but it may be a little bit expensive. Okay.
Okay, so next we have a question far away from USA. Apparently, thank you for the wonderful talk. My name is Brenda and I'm a Malaysian student.
Hi, Brenda.
Studying my master degree in anatomy at Northern Illinois University, USA. Two questions. One, could you clarify what you mean by assessment for learning? And the other one is assessment as learning. And what are some examples of online formative assessment in anatomy that are effective for undergraduate and postgraduate medical students?
Okay, good question, Brenda. Thank you so much. The first one, actually, okay. Assessment for learning, as I mentioned earlier, that is assessed by the lecturers. Okay, assessed by the lecturers. Both are formative assessment, but assessment for learning is assessed by lecturers, and it is usually done in the class, okay, during the class. Okay, so through intra-class activity. For example, if you're conducting your lecture right now, you need to take a break. Okay, now we're going to conduct a small activity, okay, like discussion, okay, go into your group, something like that. Or you can perhaps like simple question, simple Q&A, simple quiz, okay, that can also be done, like online quiz, right? Online quiz. So that is also assessment for learning. But assessment for learning must have the feedback component, meaning that the lecturer need to give feedback immediately to the student. Okay, for example, after the student have done that activity, lecturers must give immediate feedback to the student. Okay. And for assessment as learning, this one, the assessor is the student themselves, okay? The student themselves, okay? We empower them to monitor their own learning. So for example, okay, portfolio assessment, okay? Portfolio assessment, at the beginning of the semester, we give them, okay, I want you to compile any learning evidence about you learning this musculoskeletal system, for example. Okay, we give them objective and they have to compile what they have learned throughout the semester and give their reflection and so on and so forth. So we will not, and perhaps at the end, we can have a discussion with the students to look at their portfolio. Okay, when they submitted our portfolio, at the end, they actually have learned something through their experience completing the portfolio. But I think, as I mentioned earlier, it's very difficult to achieve in anatomy. Perhaps we can think this as a whole, okay, together how we can actually create assessment as learning for anatomy, especially to the novice learners, okay, the undergraduate preclinical year students. But we have a very good example at the moment, which is the Silent Mentor program. Okay, that is a very good example of assessment as learning. And your second question is about example. I think I have mentioned a few just now, like discussion, quizzes, right? Giving them a workbook, okay, and then we can assess later, or I mean, let's assess during the class, okay. And what was the question just now? What some example of online formative assessment anatomy that are effective? Okay, when we want to say effective formative assessment, there are actually 4 features that we need to consider. Okay, number 1, we must reassure, okay, or confirm that the learning is happening. Okay, learning is happening. So how to do this is by giving them immediate quiz. Okay, after 10 minutes of class or lecture, then we can stop, give them quiz, 1 quiz only. Okay, if they can respond to our quiz, so meaning that they are learning something. At least that is the least that we can do within the time limitation. And secondly is the assessment for learning should promote reflection. Okay, although I said just now that is a component for assessment as learning, but for assessment for learning also it should promote reflection. How? Through discussion. Okay, this actually opens the door for collaborative learning. Okay, for example, how to do that? Okay, for example, like in our TBL, team-based learning, our problem-based learning, this can be done online, but they can still discuss. Okay, the third one is about the assessment of learning also need to should be able to shape the values. Okay, shape the values, meaning that it can actually promote effective learning. For example, like student would be able to describe something using their own word. So perhaps we can just ask them one-to-one during the session. It's as simple as that. Okay, and number 4 is about the feedback component. Like I've mentioned that just now, we as educators need to have a good feedback mechanism ability, meaning that we need to have this art of giving feedback. Okay, giving feedback is in terms of the process, personal, and also the task. Okay, personal feedback must not be demotivated and condemning. Okay, so that's the G's of preparing a good formative assessment. I think, and another one is to promote the future learning. Perhaps we can give like activity after class. Okay, simple task after class.
Yeah, I think that's also answering a question from Dr. Murni. Since we have very limited time, is it possible to take one more question from Dr. Sharifah Aisha, and you have to answer in 1 minute? Is it possible?
Okay.
Just
I'll try.
Yeah, thank you, Prof. Very informative session. Let's say we give online quiz to the student, but we don't have enough time to discuss and give feedback. Is it okay if we just provide the answer for them to refer? Is it considered as giving feedback?
Yes, it's okay to do that, but remember, we can always do it after class. Okay, especially if you are not the one who if you don't mind student contacting you through WhatsApp, that's a very good alternative. Okay, perhaps what I always do in my class. Okay, we have limited time right now. Okay, I tell you what, I just give you the answer, and those and I will post my feedback in the e-learning session. So that is what I always do. But some of them actually contacted me after class, okay, after class during WhatsApp, and I always entertain them. The only thing is that 1 minute. The only thing is that if I do not have time,
Sorry.
I will just mention to them. I'm sorry. Can I contact you later? So I think we have to develop the trust between the student and us. Okay, when we develop that trust, okay, student will learn better in our class, inshallah.
Okay. So actually, there's one. I think you can answer this within short period. From Dr. Wong. Dr. Siti, what is your opinion of using photograph and actual specimen for anatomy assessment without jeopardizing anatomy JNL assessment? Thank you.
So sorry, can you say it again?
What is your opinion of using photograph and actual specimen for anatomy assessment without jeopardizing anatomy JNL assessment?
Without jeopardizing
the quality of anatomy and teaching anatomy assessment.
Doesn't matter if you want to use drawing, diagrams, images, whatever tools that you want to use in your assessment. You have to make sure that it's undergo proper vetting session. If it is not clear, so it is not good. When it is clear, it's up to good quality. So I think as long as it can is clearly portray what you want to ask to the students, so it will be good.
Okay, thank you very much, Dr. Siti, for the answer and the sharing information. I know that there are lots of other questions from the participants since we have very limited time. So you feel free to contact Dr. Siti through the email address that's shown on the screen. Inshallah, she will happy to help you. Thank you very much. I think you open up my mind actually. Instead of focusing just on the challenges, actually we do have a lot of practical approaches as alternative traditional anatomy assessment. Okay, thank you very much.